irregular periods, unexplained weight gain, acne that won't clear up no matter what you do, hair thinning on your head, but growing where you don't want it, exhaustion that never fully lifts. For millions of women, these symptoms get dismissed, written off as stress, attributed to poor diet, or simply told, this is just how your body is. But for many of those women, there is a specific hormonal condition quietly driving all of it. It's called polycystic ovary syndrome, PCOS, and it affects an estimated 1 in 10 women of reproductive age worldwide. That makes it one of the most common hormonal disorders in women. And yet, it takes an average of 2 to 3 years to get a diagnosis. Some women wait much longer. So what is PCOS? And why is it so hard to catch? PCOS is a hormonal imbalance. In women with PCOS, the ovaries produce higher than normal levels of androgens. That's the category of hormones often called male hormones, though everyone has them in varying amounts. This disrupts the normal cycle of egg development and release. The word polycystic refers to the appearance of small, fluid-filled follicles on the ovaries. Though not every woman with PCOS has visible cysts, and not every woman with cysts has PCOS. The naming itself creates confusion, even for doctors. Here's what makes PCOS particularly complex. It looks different in every person. Some women have irregular or absent periods. Others have regular cycles, but elevated androgen levels. Some have the classic ovarian appearance on ultrasound, others don't. There is no single test that definitively confirms it. Diagnosis requires ruling out other conditions and meeting a combination of criteria. This variability is exactly why so many cases go undetected for years, and the symptoms extend far beyond reproductive health. PCOS is deeply connected to metabolic function. Women with PCOS have significantly higher rates of insulin resistance, meaning their cells don't respond to insulin efficiently. This drives higher blood sugar, increased fat storage, especially around the abdomen, and makes weight management much harder. It also raises long-term risk of type 2 diabetes, cardiovascular disease, and endometrial issues if left unaddressed. The mental health impact is also real and often underacknowledged. Research consistently shows higher rates of anxiety and depression in women with PCOS, driven both by the hormonal imbalances and by the frustrating experience of having symptoms dismissed or misunderstood for years. Here's what's important to understand. PCOS is not rare, it is not a life sentence, and it is not your fault. It is a complex hormonal condition that responds meaningfully to lifestyle factors, particularly around blood sugar regulation, stress management, and sleep. If you have been experiencing unexplained symptoms, irregular cycles, persistent acne, fatigue, difficulty managing weight despite consistent effort, it is worth having a conversation with your doctor. Ask specifically about PCOS. Ask about androgen levels. Ask about insulin resistance. You deserve answers, not dismissal. Your body has been communicating something important. It's time someone listened.